So my name is Mr Shakil Patel. I am a consultant spinal surgeon working at the Queen's Medical Centre in Nottingham. That's a difficult answer, or it's a difficult question. It's not quite so straightforward. I think there's several reasons. First of all, when I was a teenager, I was quite rowdy and not quite so straightforward, and therefore was, if I carried on the same trajectory, it would have been a complete failure, and I think life would have turned out very differently. So one of the main reasons which drove me to get into med school was to prove to everyone that I can do it and it can be done. And then following on from that, I always did enjoy helping people and at the same time being quite practical. So medicine was the only sort of, essentially vocation or profession that allowed me to put all these three things together. Uh, and and I think, but the driving force behind that was just to demonstrate that it can be done even by someone like me. And I think that's what drove me to become a doctor. So surprisingly, when I was a medical student, I really disliked surgery, which again is quite ironic considering that I'm a spinal surgeon now. But after I qualified, surgery allows patients to come in with significant pain and discomfort, and surgery was a specialty which would allow us to try and rectify that quite rapidly, whether it be pain or discomfort, and thereby improve the quality of life. Uh, and and that's where I came to orthopedics, because orthopedics, the advantage of orthopedics relative to other surgical specialties is that the results are more or less instantly gratifying. If someone has a knee problem, you address that problem. Someone that has hip arthritis, you address that arthritis, give them a hip replacement, and the pain is in most cases is instantaneously better after the surgical insult, and they're quite functional afterwards. With regards to spines, the reason why I chose to subspecialize in spines, I think all credit goes to my mentors who guided me to this. I used to find it very inspiring. But the reason why I enjoy spines is several reasons. First of all, it's quite challenging in terms of the diagnosis because there's often an overlapping of specialties such as neurology, neurosurgery, as well as hip and knee related problems to try and identify that focus to be the spine. But in addition to that, I found the deformity aspect of it very challenging and very rewarding at the same time. And as a result, I found myself drifting down the route of spines, and I haven't regretted it since then. And I thoroughly enjoy it. So I think I've answered this in the previous question somewhat, but I think what I find very rewarding is trying to improve. But first of all, the rapport that I develop with my patients. A lot of them come to us after trying to manage their pain via multiple methods, which have essentially just prolong their suffering and affect their quality of life. So what I find most rewarding in the DGen practice is improving patients' symptoms, their pain, and thereby allowing them to continue with a normal quality of life, get back to work and get to do the things that they enjoy doing. In terms of the deformity practice, the results are very, instantly satisfying when you correct a spinal deformity and you see the results and you demonstrate this to patients, which they find, very, very satisfying. And I think the satisfaction I get from that is what I find most rewarding of my job. I feel, and I've had good feedback from my patients, such that I develop a very good rapport with them. I think spine surgery is very delicate, and most patients that come to us are obviously very concerned, especially with the small but catastrophic risks that are associated with this specialty. So as a result, I'm always very open and honest and transparent with my patient, and I develop a sort of working relationship where essentially I put them at the center of my discussion and my decision making, and I support them with the evidence that I have and the skill set that I have to try and facilitate them to make their own decisions. And I think that's what my patients value most about me. Um, what do I value about my patients? I think most of them that come are here to improve their quality of life by improving their pain and their comfort. And I think because of the rapport that I developed with my patients, I think we have a good working relationship where, because I'm honest and transparent, I don't try and, you know, uh, I try and be completely honest with them in what the likelihood expectations should be with spinal surgery. And some of that may not be completely eliminating all their pain, because there's often multiple factors. So I think, what I like is that I have that engagement with my patients, which allows me to deliver realistic expectations from surgery and treatment. Yeah, I think the realities for me, especially with degenerative disorders, is that actually, there's no going back from surgery. So surgery for me has to be the last resort.